factor. Okay, so tonight's topic of discussion is rheumatoid arthritis versus osteoarthritis. Pain is one of the ailments that can rob us of a good quality of life. As we age, this phenomenon has cost healthcare organizations billions of dollars. Arthritis is one of the leading causes of diminished quality of life in the elderly. So, what I would like to do is to list a few of the differences between osteoarthritis and rheumatoid arthritis. Let me see something here. No. Okay, so first, let's start with rheumatoid arthritis. It's usually abbreviated as RA. It is an inflammatory systemic condition. It's symmetrical, meaning that you get it on both sides, like both arms, both legs, and so on. It is usually worst in the morning, and stiffness lasts several hours. On the other hand, osteoarthritis, which is commonly abbreviated just OA, it's a non-inflammatory condition. It's asymmetrical, meaning that you can have your arthritis on just one side. Let's say, for example, the right hip or the left arm and not the other. Okay? It is usually worse in the evening. The stiffness when one wakes up in the morning usually lasts for about 30 minutes or less. But as the day progresses, the pain would get more severe. This disease is usually called wear and tear disease. So it's usually seen in the elderly. And what happens is the cartilage that covers the bones at each joint, it's worn down. So the bones are rubbing against each other. All right. Okay, so let's go back over to rheumatoid arthritis. So as before, I said it's systemic, meaning it's all throughout the body. The antibodies circulate in the bloodstream, and it is considered an immune disease. It can affect your eyes, heart, and other body organs. It usually affects the smaller joints, like the wrist and the ankle, fingers, and so on. Usually, inflammation of the synovium is the main cause of the pain and stiffness. Usually there's redness, fever, and joint fusion can take place if the joint is not used for a long period of time. Now let's compare that with what happens when you have osteoarthritis. Osteoarthritis is classified as a biochemical degenerative joint disease. I hope I said biomechanical. I'm not sure what I said, but that's what I meant. Biomechanical degenerative joint disease. It mostly affects weight-bearing joints. For example, the hip, the knees, and the lumbar section vertebrae of the backbone. Okay, so as I said before, the cartilage deteriorates and exposes the surface of the bone and cause two bones at a joint to rub on each other. And also bone spurs develop. They're usually called osteophytes. And this can be very painful. All right. Now back with the rheumatoid arthritis. Um, the cause is really unknown as to, why someone comes down with rheumatoid arthritis. The big difference of how the patient presents with rheumatoid arthritis is that the joints are spongy, soft, and it swells, and usually it's red. So it's red and tender and so on. Now, on the other extreme, for osteoporosis, the joint is usually um, stiff. And like I said before, there is bone spurs, and the deterioration of the bones takes place, and there is sclerosis of the bone, hardening and brittling of the bone. It usually happens because of repeated injury. It can be genetic. Individuals that perform strenuous jobs, like you're on your feet a lot of hours per day, you're doing menial tasks. Person is overweight, and subsequently, it's mostly seen in the elderly, people in their 50s and over. Normally come down. Most people like to say 60s, but I've seen many people after working in healthcare for over 30 something years, they come in during their 50s and sometimes even 40s, suffering from osteoarthritis. So the joint is hard and bony, and it's usually enlarged. Okay? So that's in a nutshell is the main difference between the two types of arthritis. Now, let me discuss a few of the tests that are used to diagnose um, these two arthritis. So let's start again with rheumatoid arthritis. So this is my specialty because this is where the lab comes in with helping the doctor to diagnose the patient. So SED rate is usually abnormal, very high. CRP is positive. The patient's iron is low. Um, all of the serological markers are usually abnormal when someone has rheumatoid arthritis. For example, ANA, abnormal, and patient can titer very high titer. Some of the other tests that are done, anti-CCP, WBC count, it's WBC, the white count is usually greater than 2,000, that's very low. Usually you see it way, way above 10. It's in the teens, like 13, 14, 15. It's usually high. All right. And the patient is usually treated with DMARDs. Now, for osteoarthritis, most of the times, the test that is used to diagnose osteoarthritis is usually an X-ray. because using X-ray, you can see the bones. And in the joint of a person who has osteoarthritis, you can actually see the osteophytes or bone spurs. There is also narrowing of the joint space. Okay, so that is crucial, a crucial diagnosis. Other than that, most of the times the doctor, by looking at the symptoms the patient has, the doctor will be able to put a hard and fast diagnosis that, yes, this patient has osteoarthritis. But other tests that can be done are CT scan. So CAT scan can show the bones, and the narrowing will be seen on that. Also MRI. But usually an X-ray is done because the X-ray is so much cheaper than the MRIs. Yes, it exposes you to more radiation, but that's usually what is used. Okay? Patients that have osteoarthritis, they normally have normal iron level. So there's no anemia like in RA, where the patient is usually anemic. Okay, now let me see what else. The WBC. WBC is usually less than 2,000. I don't know. I wouldn't say less than 2,000. This is from some of the research that I've done, because normally when a patient's WBC is hitting 3,000, it's abnormal. So I would say it's gonna be below 3,000 or so, because 2,000 is already very low for white blood cell count. All right, so the patients are put on medications that are called NSAIDs. All right, and what else? Okay, so yes, so the treatment basically for the two conditions have some variation. So like I mentioned before, DMARDs are the type of pharmaceutical that is used to treat RA. Patient might be given iron, vitamin B12, and folic acid. Exercise is usually good to incorporate in one's daily life. However, exercise usually should be mild. And weight loss, that is also very important. Now, for osteoarthritis, usually the condition is treated with steroid injections, heat and ice treatment. Mild exercise is recommended, and definitely weight loss. Any amount of pounds that can be shed to alleviate some of the weight of that joint is going to help. Okay, and as mentioned before, non-steroidal anti-inflammatory drugs are what are recommended for patients who have osteoarthritis. Topical pain medications are also used to alleviate pain, and other prescription medications in general. Now, when all else fails, surgery is pretty much the next alternative for individuals who are suffering from osteoporosis. This can be very invasive. For example, a hip replacement involves so much, and it's not really a cure because hip replacements are usually they usually last about 10 to 12 years before you have to do them again. And your whole lifestyle has to be modified. I mean, some people have good outcomes, but I've seen people who get worse after having hip replacement. If it's the knee that the osteoarthritis is in, usually knee surgery is recommended. That is not as invasive as a hip replacement, and most people undergo those and get some relief from their pains. Okay, so let me see what else I can share with you on the matter. I think that's pretty much it as it regards to osteoarthritis and rheumatoid arthritis. Um, I'm gonna hang on a little bit there. I wonder if I should leave it till. Okay, I'm gonna let it run. Okay, so there are 3 channels that I'm trying to get up and running. I have Answer Me TV. I have Housewise TV. That's HOUSEWISE TV. And I have Aces Merch. Aces Merch is my YouTube channel for my t-shirt shop. And because of the big C, I haven't been doing anything with it, but I think I'm ready. I was sick myself. Past 2020 wasn't a good year for me. And so I am going to get it back up and running. I've gotten somebody to help me with, you know, doing the more work, doing most of the work. And so I'm gonna be posting on Tuesdays. I am going to be on Aces Merch, and I'm gonna be demoing like some of my t-shirts and things that I made at my store, and have a little chat on that. Anybody wants to join me, it's same time like I meet on Saturdays. It's gonna be Tuesday at 8 p.m. And that's what I'm gonna be doing. Even if I'm by myself, I don't mind. If you have to have determination to do whatever you decide to do in life. You can't make, because you don't have support, you don't do what you really want to do. So that's what I'm going to do on Tuesdays. Going to have a live with t-shirts and mouse pads. What else? All this stuff that I have been creating over a couple of years. I have them stacked away because, the big C and most business places and so on were so affected. But I'm ready to resurface. And so that's what I'm going to be doing. Housewise TV, that's going to be my channel for building. I have a lot of the progress that building my house, all the stuff I did and so on. I have them stored away, and I'm going to be uploading some of those videos. And let me see. When I get 1,000 subscribers on my Answer Me TV, I'm going to be giving away some gifts. Let me see. When I reach 1,000 subscribers, I'm gonna give away $100. That's first prize. Second prize, I'm gonna give away 1,200 Digicel minutes. Third place, plus some merchandise. So it's gonna be 1,200 Digicel minute plus merchandise. Some of this stuff I made, t-shirts and mouse pads and stuff like that, and mugs and so on. Third place is gonna be 600 Digicel minutes and merchandise. So I think I'm gonna use that as an incentive to get a few more subscribers. And that is for the Answer Me TV channel. Okay? I might do something similar, and I probably will. I haven't thought it out as yet. I might do the same on my other 2 channels. But let's see how it goes. Yeah. Okay, let me see. I can't think of anything else right now that I want to announce. But I'm just gonna hang out a little bit, see if anybody shows up. I usually want to go up to 9 o'clock, 1 hour. So I'll just work on stuff that I'm gonna post and see if anybody pops in.
than his last car, and he just basically got cash for it, his old car, and this is the car that he's driving now. So be on the lookout for this car in the Tennessee area, Smoky Mountains area.
In it at 45 minutes. was June 2019 when I stepped on